checking in this evening, and I thought I would talk about keto misconceptions. Have you heard of these? There's a Healthline article that came out either yesterday or the day before yesterday, and someone sent me a copy of it. And I have heard these for 20 years, and I just it just makes me cringe every time I see them, because we have to rehash this over and over again. And I have patients come to me saying, "But Dr. Nally, what about this? Have you heard this? What about this keto? Is it gonna kill me?" So I figured I would talk about the 7 misconceptions that are posted now on the top nutrition sites of the world, and let's debunk them if we can. Hopefully, it'll be fun, and it'll be fun for me at least. Maybe it'll be fun for you. We'll see. So I think let me introduce myself here. My name is Dr. Adam Nally. I'm a board-certified family physician and a board-certified obesity medicine specialist. I practice in Surprise, Arizona, which is a suburb of Phoenix, Arizona. I've been in practice about 20 years and enjoy doing what I'm doing. I ran from room to room, stomping out disease and trying to plunge out the pestilence that arises within the area. So it's been fun. So I will jump in here. I'm a little later than normal. It has been a long week, and I just didn't quite get to my live stream till an hour and a half later. So anyway, if you're signing on, I welcome. It's good to have you. If you're watching the replay, wonderful. I'm going to roll this over to YouTube. And so if you're watching this on the replay with YouTube, check this little box right here to subscribe. Go to my website, docmuscles.com, and follow me there, and you'll get copies of my blogs as I post them out and things like that. Check out the coronavirus page I have there, giving you updates almost daily on coronavirus and all the stuff that you need to know. And so hopefully that'll help you as well. If you like my Facebook content, go over here, or maybe it's over there, and sign up to follow me when I go live on Facebook. So hopefully you'll be able to jump in and see this. If I don't see anyone popping onto the screen, usually it takes a minute to a little bit of a delay. But if you're new to the broadcast, put a big capital N in this screen, and if you're and let me know where you're from, because I'd love to know where you're from. So let me pop up here on the screen here the most common keto misconceptions. Hello, Paola. How are you? It's good to see you. So misconception number 1. I'm going to see where this pops up at. The dreaded keto flu. The dreaded keto flu. This is not the flu. I've had a couple of people say, "I don't want to get the keto flu. I can't do keto because the other flus are going around." Okay, this is not the flu. It's described as the keto flu because you feel fatigue. But as I had a couple patients today, when you're not taking in enough salt, you feel fatigued. And this is usually due to the fact that most people are afraid of salt. And if you haven't been using adequate salt, sodium, potassium, magnesium, and zinc, you're going to experience body aches and fatigue. And literally within 5 minutes of taking in some salt and some water, you're going to feel better. So the keto flu is not the real flu. Keto flu is usually salt deficiency, or it's just the fact that you're keto adapting and you're not used to using fat as your primary fuel, and it takes a little bit to get caught back up. And it's usually due to salt insufficiency of some sort. I apologize. My dog is in the background barking at the neighbor's dog, so you'll hear my dog bark. She's a good guard dog. Anyway, welcome if you're new to the broadcast. It's good to see you. Fantastic. All right, so we talked about the keto flu. This is usually due to just not taking in enough salt. I'm a big fan of Redmond salt. I use anywhere between 2 to 4 teaspoons of salt per day, depending on how much you're exercising and sweating. Well, the average person needs 1 to 2 teaspoons of salt every day. We used to call the term salary is derived from the Romans because they were given a salary of salt to live on that week. That's how important salt used to be when we ate a diet that was correct. Now that we eat garbage as a society, the high insulin response from the garbage that we eat stimulates us to retain salt, and so we've demonized salt, and that's a problem. All right, next item: stress on your kidneys. This terrible thing. Have you been told that if you do a ketogenic diet, it's going to stress out your kidneys? Well, amazingly, there are multiple studies published, and I wrote a whole chapter on it in my book, The Keto Cure, that if you're doing a ketogenic diet, your kidneys actually get better. It actually heals the kidneys. They don't get stressed out. I have yet, in 20 years of private practice and 3 additional years as a resident, to ever see a bodybuilder in renal failure. I have yet to see one. There are no bodybuilders in renal failure. Doesn't happen. Unless they damage their kidneys in some other way. The high protein intake from bodybuilders you never see bad kidneys. This high protein misnomer causing stress on your kidneys or shifting into an acidic level and hurting you is actually the biggest crock of crap I've ever heard. It is literally false. I don't know how it keeps getting pushed by the nutritional world, but it is absolutely false. And there is not a single research study to prove that a ketogenic diet is bad on your kidneys. There's multiple to show that your kidney function improves. And I have thousands of patient studies to show that when I put you on a ketogenic diet, your GFR gets better, your creatinine gets better, and people's kidney function overall improves dramatically. And I can show you patient after patient clinical evidence of that. All right, digestive issues. This wonderful Healthline article said, if you eat keto, it's going to cause a change in your gut bacteria. Yeah, your gut bacteria will get better. There's 3 articles that talk about the fact that if you eat a diet based in meat and fat and leafy greens, that your gut bacteria rebalances back to the normal level that you see when you're born or when you have a healthy gut. It's the high carbage that you eat that actually shifts that gut bacteria to a poor state. When you change your diet, your gut bacteria will change. That's good. This implies that change in bacteria could be bad for you. With a ketogenic diet or a carnivorous diet, your gut bacteria heals. And I can show you multiple studies in the medical literature where your gut bacteria gets better. I won't go into that because it may bore you, and it's kind of smelly to read about it. But that's right where the bear poops in the woods, to be frank. All right. Next item, nutritional deficiency. With nutritional deficiency, it says if you eat a ketogenic diet, you're going to have deficiencies of nutritional issues. You won't. Remember, we started telling people to eat 12 servings of fruits and vegetables every day because we took away the fat where the nutrition is found at. Nutrients are found in animal fat. And when you take away animal fat, all of a sudden you become nutrient deficient. And it's hard to get the things you need. Like I said a couple of days ago, all of the vitamins, if it sounds like a letter of alphabet, except for C, is found in animal fat. Vitamin C, though, is found in kale and leafy greens and broccoli. And so if you're eating a little bit of leafy green once in a while, you're going to pick up plenty of vitamin C. Not a big deal. So the nutritional deficiency issue is not an issue. But they always go back and quote studies in the 1940s and 50s saying, look at these kids who did ketogenic diets, who had epilepsy. They had selenium deficiencies. That's because they were eating really bad, poorly prepared keto shakes that were not nutritionally balanced. They weren't eating real food. If you're doing a ketogenic diet that contains real food, you're just fine. Never had a problem in 20 years with patients. Well, 16 years with patients. I've been doing ketogenic diets for about 16 years. Been in practice 20 years. All right. Low blood sugar. Are you going to have low blood sugar with this ketogenic diet? Well, if you cheat all the time, yes. If you're eating adequate protein and fat and you cut out the carbs in your diet, you won't have low blood sugar. The only time you're going to have low blood sugar is if you keep taking the diabetic medicines that you don't need when your blood sugar starts to normalize. If you're on diabetic medication, and you change your diet and you're not closely watching to see if that medicine's becoming too strong for you, you could also have low blood sugar. That's something to be aware of. But if you're on diabetic medication, my hope is that you're going to be talking to your doctor about modifying that medicine as your blood sugar gets better, because it will get better. I have yet in 16 years to see a person who does a ketogenic diet and their blood sugar doesn't dramatically improve. And I have hundreds of patients who have dramatically reversed their insulin resistance, prediabetes, and over 100 patients who've reversed their diabetes, their type 2 diabetes, completely gone. It's wonderful. It's amazing. You can reverse diabetes with a ketogenic or carnivorous lifestyle. You actually can. All right, bone health. If you eat all this fat, it's bad for your bones. No, it's actually not. The problem is, again, this goes back to, they did studies on some epilepsy children who were in hospitals with epilepsy that wouldn't eat real food, that were given these poorly prepared shakes that didn't have adequate vitamin D, adequate calcium, or adequate trace minerals, and you ended up seeing changes with skeletal health. But you can't make that quote with a person who's eating real food. If you're eating real animal fat, you're eating bacon, ribeyes, hamburger, chicken, fish, turkey, and some leafy greens, you're fine. You literally will not have those nutritional deficiencies. That is again another misnomer. All right, lastly, increased disease risk. And this is always what they throw at the last part of every one of these naysayer articles. You're going to have this increased disease risk, because you're eating an animal-based diet. And they go back to this quote where they say, well, we did this big study on a bunch of nurses, the Women's International Health Study, where they basically looked at close to 100,000 women and split them out. And these were nurses who ate hospital food, by the way. And they sent them a questionnaire every 2 years over a period of about 15, 20 years. Now, if you remember what you ate last week, I'm shocked. But if you get a nurse to remember what she ate 2 years ago, I'm even more shocked. But they quote that these surveys every 2 years gave them adequate data to tell you that the people that were eating low carb had increased risk of heart disease. That is absolutely impossible. Worst study design I've ever heard of. To ask me what I ate over a 2-year period over the last 2 years, and then say, yeah, your diet caused your heart disease or your vascular disease. Absolutely inappropriate way to make an assessment. So when they quote that study, and again, you'll see that on a bunch of the fancy vegan and vegetarian movies, that they say, oh, those animal-based diets, they cause disease. Number one, they weren't actually truly eating a low-carb diet. And if they claimed they were, how do you know? Because you only check them every 2 years. There's no way to prove they were in a ketogenic state for 2 years when you ask them a questionnaire on what they ate over that 2-year period of time. It just doesn't work. So I find that that's just absolutely nuts. Anyway, that was my high horse. The 7 reasons or misconceptions that I commonly hear about every single day from people, and was recently in a big news article saying, be wary of those ketogenic folks. It's going to cause these problems. So, anyway, I'm ranting. Well, let me go back and look and see. If there are any questions on here, it's good to see you guys. Hope everyone's well. Hello, Charlie. Hello, Vicky, tuning in from California. Hey, Dave, how are you? Let's see here. Julie Hammond, good to see you. Hey, Tammy, it's awesome to see you. So Kim says, now I'm going to try to show these on here because it's actually kind of cool. Kim says, hello, Kim. I learned that I'm hypothy after 6 months of keto. What is hypothyroid? Is that what that means? And negative results. Take nature now and what a difference. So a lot of times you can be hypothyroid even though you're on a ketogenic lifestyle. Hypothyroidism is driven by a number of different things. And if you're not seeing success with your ketogenic diet, the first thing I would check is your thyroid function. And as Kim points out, if your thyroid function's off and you fix it, you're going to feel fantastic. So congratulations. That's awesome. Very good. I don't know if there's a question there, Kim, or not. All right. Ozempic injections, are they necessary? Kim, I use Ozempic with a lot of my diabetic patients, and I find them to be very necessary in helping people bridge and move back to a more number one normal lifestyle and control the sugars in the period of time as the pancreas begins to heal, if we can get it to heal. Many times, if you're a type 2 diabetic, we can use drugs like Ozempic and Victoza and Trulicity to improve the pancreatic function, suppress appetite, help the process of weight loss as we move through the ketogenic lifestyle, and eventually get you off the medicines if we can get that pancreas to heal. But so I find that yes, they're very helpful, they're very necessary, but you need to be monitored on a regular basis to make sure that the medicine is working and it's not becoming too strong, because it could become too strong as your pancreas gets better and better. So hopefully that answers that question. Hello, Heather and Tammy, and Patty. Let's see here. 2 nights in a row. I've actually live streamed for 5 nights in a row. I'm going to roll these over to YouTube, so you're going to see them on YouTube. For those who want to check out, I'm trying to live stream nightly if I can. That is my new goal. Am I concerned about the coronavirus? Lynn or Thea, I am absolutely concerned about the coronavirus. In fact, if you go to docmuscles.com and there's on the browser menu, it says coronavirus. Click there. I have been updating that daily for the last 2 weeks on all the necessary information that I think my patients and those that follow me should hear and should understand about the coronavirus, and why I'm concerned, but why you should not be horribly fearful, but be very aware that this is a dangerous virus. It does have potential to do some significant damage, and there are ways that we can protect ourselves. So I don't want people to be afraid, but I want to be well informed. So go check out my blog or my page. I started blogging and then moved it over to a page because there was so much information. So there's a whole section in docmuscles.com about the coronavirus. Go check that out. Hello from Spartanburg. Hello, Brenda. How are you? Thank you for the good quotes. I appreciate that. Can you do keto shakes occasionally? That depends on the type of shake. Yes, you can. It just depends on what the sweeteners are. I had a patient come in today that was doing keto shakes, but the sweetener was a sulfate potassium, which spikes insulin all by itself, and it was causing weight gain. So you've got to be wary of what those shakes are being sweetened with and how they're made. They're very important. Hello from in Michigan. How are you guys doing? Good to see you, Crystal. Hello from Tucson. Hello, Evett. Nice to see you as well. You caught my live. Let's see here. Hello, Cambodia. Oh my gosh, Karen, are you in Cambodia? Wow. Are you transplanted to Cambodia or were you born there? That's impressive. What time is it in Cambodia? All right. Hello from New York. Jeremiah's vanished in New York. Hello, Dan. How are you? Good to see you. Closed captioning is on. Oh, well, that's good. Oh, well, it must be rolling it over to closed captioning. That's good. All right. Thanks so much you're welcome for the time. Hopefully it's getting my, the captioning correct. Is it spelling stuff wrong? I can't see the captioning because I'm actually broadcasting to Facebook Live. So I don't know if it's captioning it on Facebook and what it's doing or how it's doing that. Let's see. Do I have a starting meal plan? I actually have found for many people, Pauline, that giving people a meal plan doesn't, whenever I handed out a meal plan, the first thing I get is, I don't like that. I don't like that food. I can't eat that. Not that you're going to do that, but that's what I hear a lot. And so that was actually very discouraging because most of the people didn't want to eat this food or that food. So what I did instead is I wrote a diet, and you can find that on my Dark Muscle site, that basically says these are the principles behind a diet. Now you use those principles and you create the diet and the meal plan that you like. There are hundreds of meal plans out there. And in fact, in my book, The Keto Cure, Maria Emmerich wrote 60 recipes. So there's plenty of recipes in there for a meal plan if you want to use my book to start out there. So I have not done meal plans because I just don't want people to be upset about it. I don't like that. So anyway, for what it's worth. Hello from Florida. How are you? Let's see. It's 10:40 a.m. there in Cambodia. Moved 2 years ago about the time I was trying to. Wow, that's impressive, Karen. Well, enjoy Cambodia. I hope you're having a nice time. The weather's nice there, and I'm assuming you're near a beach, and that's probably nice too. All right, let's see. Is there a weight loss pattern on? I'm not quite sure what that means, Dennis. A weight loss pattern on. Down 90 pounds, 11 months, 11.5 arms, like chest improvement, midsection. The midsection is always the last to go. So be aware that midsection won't totally improve until you've healed the insulin resistance, and it takes literally 2 years to heal the insulin resistance. The closed captioning is correct, and it's very fast. It can keep up with my 600 words a minute, can it really? I talk fast. And if it keeps up with my 600 words a minute, I'm impressed. That's really impressive. And I don't know how to turn the closed captioning off. Maybe I'll have to go to Facebook and see if that may be a setting that I turned on there. I'll fix that. All right. Thanks so much for doing this. You're welcome, Jonathan. 2 days of restarting keto, and I found the berries are helping me. Oh, good. That's fantastic. So we talk about the use of a small amount of berries, a half cup of berries. Berries do contain a little bit of carbs, about 7 grams per half cup or 15 grams per whole cup. So if you did a half cup of berries as your treat or snack that day, it's great. And guess what? There's vitamin C in berries. So you can actually get a little vitamin C from strawberries or raspberries, blackberries, blueberries. So that's another source of vitamin C. Just don't overdo the berries, Jonathan. That's my only suggestion. If you're like me, I can get away. I can run away with the blueberries. So be careful. I bought your book, Keto Cure, and love it. Do you recommend daily fasting or just eating when you're hungry? I really, James, recommend eating when you're hungry. If you'll find that if you eat when you're hungry, you're going to see most success that way. It stimulates periods of natural fasting. I find that I eat a dinner, and I probably won't eat again until the next day around 12:30 or 1:30. And so I usually naturally fast for about 16 hours just because I'm not hungry till lunchtime. So it's very natural. A lot of people do that. I did about 2 ounces to start today. Perfect. All right. Fantastic. Does monk fruit spike blood sugar? Well, remember, Rhonda, monk fruit is fructose. So your blood sugar does not go up with that. It actually is metabolized through the liver just like alcohol. And it stimulates the same response that alcohol does, raising your blood pressure, increasing uric acid, increasing the risk of kidney stones and gout, and increasing the aldehyde, which stimulates a spot in your brain that, just like morphine, that goes, ooh, that was good. I want more 2 hours later. So I am not a fan of monk fruit. It doesn't spike insulin with everyone is the same because everyone processes fructose slightly different in their liver, just like everyone processes alcohol slightly different in their liver. But monk fruit is a form of fructose, so I am not a fan of it, especially with my very severely insulin resistant patients. Now, a lot of keto experts out there use monk fruit in the recipes. Some people can get away with it. Most of my patients cannot, so I'm not a big fan of it. I find a few berries a day is helpful for me. Good, Kathy. Just don't overdo them. Again, that's the key. Berries are not bad. Does bulletproof coffee break a fast? Absolutely. Well, black coffee, if you're depends on your definition of a fast. If you're just fasting for food, black coffee is fine. But if you put fat in that bulletproof coffee, you've broken your fast. Fat, protein, or carbohydrate breaks the fast. So you have to be aware that can break the fast if you're doing bulletproof coffee. A lot of people, for some reason, don't get that. I don't know why that's the case, but that's something that a lot of people don't seem to grasp. Can the temperature of 97.7 indicate a thyroid issue if you had 98.6 most of your life? Well, it can indicate if you're generally running lower, it could indicate a thyroid issue as one possibility. There are other issues that could cause that too, but I would say if you're worried, have your thyroid checked. Absolutely. I've been keto for 2 years, and just out of lately, I'm starving. What do you think is happening? Well, Nancy, either you've increased your exercise and you're more active, and so you actually need more protein, or you're just not taking in enough protein because you've gained some muscle mass, or you're fighting off an infection, and your body needs a little more fuel for that reason. What is my take on sucralose? I don't mind using liquid sucralose, Nita. In fact, I use it all the time. My wife will use it with baking it in the liquid form. When you crystallize sucralose, we call that Splenda, and that causes weight gain. It's crystallized by using dextrose or maltodextrin, which is just a sugar that works for the FBI. And so you want to avoid the crystallized sucralose, which we call Splenda, bad for you. But liquid sucralose does not seem to raise insulin. So I'm okay with liquid sucralose, either using it baking or in some products. So just be careful. It's not the crystallized sucralose, but it's the liquid. Kim says 5.3 A1C on my keto-friendly doctor has me on Ozempic. Well, Kim, not knowing your background, where you are and what your goal is and what your current insulin response is, it's hard to tell you if you need any drug. I can't give you medical advice over the internet this way. But what I can tell you is I will use Ozempic to bring people's blood sugar down to a specific goal based on what our goals are in regards to weight loss or blood sugar control. And then we'll begin to wean those medicines based on where we want to put them. So, when I get people down to close to 5.4, 5.1, then we start talking about weaning off medicines. Good questions, though. Fantastic questions. Do you think it's best to keep a regular eating schedule? Not necessarily. I think it's good to learn to eat when you're hungry and not eat when you're not. If you're eating because of routine, that's oftentimes where weight gain can be problematic, or people have trouble losing because they don't know, am I eating because I'm hungry, or is this just the routine and I eat because it makes me feel good and it releases endorphins as I masticate? I didn't say masturbate. I said masticate, chewing. Those of you that get your mind out of the gutter. All right. Let's see here. Do you? Some say changing it up is good, but I have ADD and find comfort in keeping. So, all right, Evan, that's a great question. If you have a routine with attention deficit or things of that nature, that routine's great. You just want to make sure that you are eating when you're eating because you're hungry. And at that meal, if you decide, hey, I'm just not as hungry, don't eat the volume that you normally eat. Been fighting a respiratory thing lately, and yes, appetite is up. So. Oh, and you're seeing our PA on Monday. Awesome, David. So yeah, so it can explain it. If you're fighting off an illness, you're going to see that appetite go up because all of a sudden your body mobilizes its immune system. And amazingly, your immune system can require as much fuel as it takes to run a marathon. So don't be surprised by that. Julie, did my mastication comment make you giggle? There's all these fun words in medicine that have dual meanings or close to dual meanings. All right. Great questions, you guys. Hopefully that gives you some good answers and you're enjoying it. I hope you enjoy my content on here and that it's worth your time. I realize I'm pulling you away from Netflix or something important. But anyway, let me just see if there's any other questions popping on here. I've been keto for 2 years, never had acid reflux until I started drinking mineral water because of magnesium. My wife has the same problem. The excess magnesium in mineral water relaxes the smooth muscle and lets the reflux come up and you retaste your meal. It's always exciting, Dorinda. I can handle mineral water, my wife cannot, and it's because of the magnesium and the relaxation effect that magnesium has on smooth muscle. So that's what occurs with that. Can a keto carnivore diet help reverse blood disorders of protein S deficiency? Protein S deficiency is a genetic issue, and unfortunately, I wish it could fix it, but it doesn't fix it. I don't have a good fix for protein S deficiency. That's a genetic malformation of the genes, and unfortunately, that's a lifetime issue as far as we know today. Telemedicine appointment on Monday. Oh, exciting! Anxious to hear what my blood work meant. Okay, good. We'll look forward to talking with you, Vicki. Yes, Julie, that's awesome. I love it. All right. Well, any other questions, you guys? Hopefully you are having a wonderful evening, a wonderful Thursday, and hopefully you're staying healthy and well, and you're not inhaling weird coronaviruses. Remember, keep up the good work. Let me see if there's any others. Oh, I see. Sugar-free elderberry recommended for immune boost. I do not recommend elderberry during this period of time because elderberry was actually shown to be actually detrimental with the coronavirus. So I don't recommend it. Now, elderberry does stimulate some immune response, but in this particular virus, in this particular time, it was actually shown to be detrimental in a small study. So I wouldn't recommend it. Echinacea, if you start feeling sick for only 7 days, has been shown to be effective generally for viral infections. But if you take echinacea longer than 7 days, it does you absolutely no good, except for making you have really expensive urine. You're welcome. Thoughts on, well, let's see. How can I find keto doctors in my area of Charlotte, North Carolina? If you're in North Carolina, Dennis, you have one of the premier docs in town. Dr. I think is he in North Carolina or near you at Duke University? If you can go to Duke, Dr. Eric Westman. He taught me. He trained me. He's superb. Go check him out. I know he's. I think he's near that area. I've been. I don't know where his office is exactly, but check him out. I've been on, and I know there are other docs in North Carolina as well. I've been on keto since. Go to ketogenic.com or Diet Doctor, and they have some great lists of doctors in your area. You check that out there. I've been keto since 2014. I finally only have 30 more pounds to go. I'm worried that I might gain because of the stress. Okay, Dan, stop worrying because that's going to make you gain, and just keep doing what you're doing. Just be active. Keep doing what you're doing. Thoughts on creatine or creatine, James? Creatine is an amino acid. It actually stimulates the muscle to take up more water and enhances, in the short run, the strength of the muscle. I think it's great if you're wanting to bodybuild. Nothing wrong with using creatine for bodybuilding. Is it going to change the way it may slightly raise your insulin, so be aware of that. So if you're using creatine, you want to make sure you are exercising regularly. That's one of the things I have seen. Some guys that use creatine, stop exercising, and then they start gaining weight because of it. So just be careful with that. You are very welcome, Paula. Let's see. Creatine. Okay, yes, he clarified that. Creatine. Social distancing from the world right now. Oh, good, Vicky. Very good. I think I want to say Dr. Westman's in North Carolina now. I don't know which part of North Carolina. I'm pretty sure he's there. He's at Duke. So wherever Duke is, and I don't know my southeastern school locations as efficiently as I should. I'm sure I'm offending everyone in North Carolina right now. But I know Dr. Westman's at Duke, and he's got some other partners that are there, and he does a great job. So he trained me years ago. It does fantastic. I like Dr. Westman. All right, you guys. Great questions. I have been rambling on here now for I don't know how many minutes. If there's no more questions, I will sign off here. But if you have a burning question that you just absolutely have to have answered, let me know. Again, my name is Dr. Adam Nally. For those of you who don't know who I am, we just put up here. I'm a board-certified family physician and a board-certified obesity medicine specialist practicing in Surprise, Arizona. I tried to get in as a new patient a while back, and I'm booked out for a year. I'm booked out quite a ways, so we had to stop the new patients for a bit while we get caught back up. And but get my book, get my book, read the book. It's great, and it'll get you started. One of the reasons I'm doing live streams is to try to make sure people are have some questions, generally things out there. Have any of my patients tested positive for coronavirus? I have tested, I think we've tested 12, and I'm waiting on one come back. Thankfully, the other 11 have been negative. I've got one more I'm waiting on that we tested today. I'm hoping that person is negative also, but we have 508 cases of coronavirus in Arizona right now and 8 deaths. So it is a big deal. And it is a very deadly disease if you get it for 20% of the population, which is the population that I work with, patients over 65. So yeah, we are very vigilant about that. Am I correct in understanding as long as you have inflammation in your body, like a muscle where you're hurt, it may stall your more than usual weight loss? So now if you injured a muscle, that's not necessarily going to stall weight loss. But inflammation, if your CRP is elevated because of general chronic inflammation, that's usually due to high insulin or higher insulin, and that can stall the weight loss. I hope that made sense, Bobby. Another great night. Oh, good, Vicky. I hope you got a chance to learn something, smile, giggle, and maybe even blush. So that's my hope. Hypothyroid guidance. Okay, Kim, I've done an entire lecture on hypothyroidism. So to go to my YouTube channel, youtube.com/Dr. Nally, and watch the thyroid video I did for Keto Salt Lake. Gave a whole lecture on thyroid and how we approach it, what we do that way. I've also done multiple videos on thyroid, so go check them out on my website there. My creatinine is low right now due to my methotrexate. Liver enzymes up. It does that, Julie. The methotrexate can do that, so just keep. Hopefully, your doc's keeping an eye on that. I have joint pain and stiffness locking in both middle fingers. Both middle fingers. Now that could be problematic if it's both middle fingers socially, but thankfully we're social distancing, Crystal, and that hopefully won't be a problem for you. Any idea? I also have Hashimoto's. If you have locking in the middle fingers, that makes me think you have trigger fingers, and you may need to see your hand surgeon to have those checked out. That's the first thought just offhand that you may want to have looked at. Kentucky has 284 confirmed cases with 5 deaths. We just surpassed China today. We have over 80,000 cases in the United States. I anticipated we would. My concerns were just at the beginning of a 2 to 3 week surge. And so depending on how well our social distancing was effective, we'll see. I wrote a little article about if you go to my coronavirus article on my website at docmuscles.com, we talked about, I showed some slides from what social distancing did for the 1918 influenza cases that came through and the deaths there. So you check that out, and I'll give you some ideas to why we're doing this. But yes, I think it's going to get worse before it gets better. Hopefully you're safe and you're well. I have a doctor's appointment tomorrow, no fever, sore throat, have a cough. I think allergies. I'm just scared to go to the hospital because I'm pregnant. Amazingly, Heidi, women who are pregnant have a melatonin level 10 times higher than average, and that has been shown to be protective for both mom and baby. So don't worry, but there are 8 other diseases, viral infections, and I posted this on Facebook earlier and on my blog earlier about what other infections can cause symptoms that are similar to coronavirus. So don't stress. Get your doctor to check you out, and don't stress. You are very welcome, Kim. Hang in there. Keep up the good work, guys. I am going to sign off and go work on my charts. So remember, keep the fat high, keep the carbs low, and pass the bacon. Have a great night. Bye-bye.